Picture this. You're a new nurse just starting your shift on the telemetry floor. Your preceptor, Maria, points you toward room 204. Mr. Henderson's on BiPAP, she says. Just keep an eye on his numbers. You walk in, and there it is. The non-invasive positive pressure ventilation, or NIPPV machine. It's humming, hissing, and the screen is a constellation of numbers and graphs that looks more like a flight deck than a medical device. You see IPAP, EPAP, VT, It's a jumble of letters. You feel that familiar knot of anxiety in your stomach. We've all been there. It's normal to feel overwhelmed by this technology at first, but trust me, you can absolutely master it. This machine is a powerful tool to help your patients breathe, and understanding it is a key skill. Before we dive into those numbers, let's quickly break down the main types of NIPPV you'll encounter. Think of them as different levels of support. First, there's CPAP, or continuous positive airway pressure. This one is simple. It delivers one steady, continuous stream of pressure to keep the airway open. Kind of like holding a door open against a breeze. It's great for conditions like obstructive sleep apnea. Then you have BiPAP, or bi-level positive airway pressure, which is what Mr. Henderson is on. This is a bit more advanced. It provides two different pressure levels. A higher pressure when the patient inhales, called IPAP, and a lower pressure when they exhale, called EPAP. This makes it easier for the patient to breathe out against the machine. Finally, there's a mode you might see for more complex patients called AVAPs, or Average Volume Assured Pressure Support. This is a smart mode of BiPAP. It automatically adjusts the pressure support to make sure the patient gets a specific preset volume of air with each breath. It's like having cruise control for breathing, ensuring the patient gets exactly what they need, even if their own breathing effort changes. For today, we're going to focus on BiPAP, since it's one of the most common modes you'll manage on the floor. Understanding BiPAP will give you a solid foundation for understanding all non-invasive ventilation. Let's get you comfortable with that screen. So, you're standing in front of Mr. Henderson's machine. Take a deep breath. Let's look at this thing not as a confusing mess, but as a story about your patient's breathing. Every number is a clue, a piece of information telling you how they're doing and how the machine is helping. You're not just a bystander watching the machine, you're the detective, interpreting the data to provide the best care. Your role is crucial. You are the bridge between the patient and the technology. By the end of this guide, you won't just be watching those numbers, you'll be understanding them, anticipating changes, and acting with confidence. You've got this. Let's break down that BiPAP screen piece by piece. The two most important numbers are your pressure settings. First is IPAP, or Inspiratory Positive Airway Pressure. This is the higher number. It's the pressure the machine pushes into the lungs when the patient breathes in. Think of it as the inspiration helper. A higher IPAP helps the patient take a deeper breath, which is essential for getting rid of excess carbon dioxide. Next to it, you'll see EPAP, or Expiratory Positive Airway Pressure. This is the lower number. It's the constant, gentle pressure that remains in the airway when the patient breathes out. This keeps the tiny air sacs in the lungs, the alveoli, from collapsing. Think of EPAP as the airway opener. Now for the numbers that tell you what the patient is actually doing. You'll see RR, or respiratory rate, which is the total number of breaths per minute. The machine will show you the rate set by the doctor and the rate the patient is actually breathing. If the patient's rate is higher, they are breathing on their own above the machine's backup rate. Then there's tidal volume, or VT. This is super important. It's the volume of air moved in or out of the lungs with each single breath, measured in milliliters. It tells you if the pressure support you're giving, the IPAP, is resulting in an adequate-sized breath. You need to know if each breath is deep enough to be effective. Next up is minute ventilation, or MV. This is simple math. It's the tidal volume multiplied by the respiratory rate. It represents the total amount of air the patient is breathing in 1 minute. This number is a fantastic overall indicator of how well the patient is breathing. If the minute ventilation is too low, the patient isn't moving enough air to get rid of carbon dioxide. You'll also see FiO2, or fraction of inspired oxygen. This is the percentage of oxygen the machine is delivering. Room air is 21%, and on a BiPAP, this can be adjusted much higher depending on the patient's oxygen needs, which you'll track with their pulse oximetry. Finally, there's the leak value. Don't panic when you see a number here. A small leak is normal and expected. The machine even accounts for it. This number tells you how much air is escaping from the mask seal, usually measured in liters per minute. A very large leak, however, means the mask doesn't fit right. If the leak is too high, the machine can't deliver the prescribed pressures effectively, and the patient won't get the full benefit of the therapy. Your job is to check the mask fit, adjust the straps, or maybe even try a different size or style of mask to get that leak down to an acceptable level. Let's return to our patient Mr. Henderson, who has a history of COPD. He was admitted for an exacerbation and is struggling to breathe. His latest blood gas results show his carbon dioxide levels are rising, a condition called hypercapnia. This is a classic reason to use BiPAP. The goal is to help him blow off that extra carbon dioxide. You look at his monitor, his respiratory rate is high at 28, but his tidal volumes are low, around 300 milliliters. This tells you he's breathing fast, but very shallowly. He's working hard but not moving much air. This is your cue to act, in collaboration with the respiratory therapist and physician. To help Mr. Henderson get rid of that carbon dioxide, you need to increase his minute ventilation. The primary way to do this on BiPAP is by increasing the pressure support, which is the difference between IPAP and EPAP. Let's say his current settings are IPAP 10 and EPAP 5. The difference, or pressure support, is 5. This isn't enough to help him take a deep breath. After getting an order from the doctor, you might increase the IPAP to 12 and then to 15. You keep the EPAP at 5. Now the pressure support is 10, 15 minus 5. This larger difference will help push more air in with each breath. As you increase the IPAP, you watch the monitor closely. You're looking for one key change. You want to see his tidal volume increase. A good target is often around 6 to 8 milliliters per kilogram of ideal body weight. As his tidal volume goes up, his respiratory rate should start to come down. This is a great sign. It means he's no longer breathing so fast and shallowly, because each breath is now more efficient. He's moving more air with less effort. His minute ventilation will increase, and over time, this will help lower his carbon dioxide levels. You'll also keep an eye on his oxygen saturation and adjust the FiO2 as needed. This is the art and science of nursing. It's not just about following orders, it's about understanding the why behind them. You saw the problem, high carbon dioxide, low tidal volume. You understood the tool, which is BiPAP, and you applied the solution by increasing IPAP. You then monitored for the expected outcome, increased tidal volume and decreased respiratory rate. This hands-on, critical thinking is what makes you an amazing nurse. By making this one adjustment, you've directly intervened to help your patient breathe easier and prevent them from progressing to respiratory failure. That's a huge win. Even with perfect settings, things can go wrong. Let's cover some common troubleshooting scenarios. If your patient says, "I feel like I'm suffocating or I can't get enough air," the first things to check are their tidal volume and any leaks. A low tidal volume could mean the IPAP is too low to support their breath. A high leak means the mask is loose, and that supportive pressure is just escaping into the room instead of going into their lungs. Check the mask fit immediately. Adjust the headgear, make sure the mouth isn't hanging open, and see if that leak number comes down and the tidal volume goes up. What if the patient complains, "This pressure is too much," or seems very anxious and is fighting the machine? This could mean the IPAP is too high for their comfort, or the backup respiratory rate is set in a way that feels unnatural. It's also critical to check their oxygen saturation. Sometimes a feeling of air hunger is actually from low oxygen levels, and you may need to increase the FiO2. Always talk to your patient, explain what's happening, and provide reassurance. Sometimes, simply coaching them to breathe slowly with the machine can make all the difference in the world. To help you remember the most critical values to check, here's a simple mnemonic. I'm ready. It stands for IPAP, minute ventilation, respiratory rate, EPAP, air leak, delivered tidal volume, and your O2 saturation. Run through this checklist in your mind when you assess your NIPPV patient. This little tool can help you organize your thoughts and ensure you haven't missed anything important. It transforms that screen from a source of confusion into a practical and powerful assessment tool that you are in complete control of. Back in room 204, you've increased Mr. Henderson's IPAP. You watch as his tidal volume climbs to a healthy 550 milliliters. His respiratory rate settles down to 18. He looks more relaxed, his brow is no longer furrowed, and he gives you a small nod. You check his mask, tightening a strap just a bit to reduce a small leak. You've done it. You didn't just watch the machine, you understood it and used it to make your patient better. That feeling of competence is incredible. Every beep and every number now tells a story you can read. You got this.